We know that it is 2 million people living with cancer in the UK today, but we also know it is going to be 4 million people by 2030. And that's going to create a huge challenge for the NHS, for organisations like Macmillan, in making sure that cancer services are truly patient-centred, but also that cancer services in the UK are financially sustainable in the long run.
I had 18 months of treatment, and when you get to the end of that 18 months treatment, everybody around you thinks, oh, you're better. But in actual fact, that's just the start of it, really.
What we were looking for through the National Cancer Survivorship Initiative was a way of creating a package of care, which we call the recovery package, which could be delivered at the end of treatment, which would identify the needs of people as they finished their treatment and went on to the rest of their life. The recovery package has 4 components. The first one is assessment and a care plan.
Holistic needs assessment is a way of assessing a patient at various different points during their cancer journey, not just to look at the physical issues that they might be facing, but also to see what elements of emotional distress may be playing a part. So it's basically looking at the whole person, not just their cancer.
Because this is a pilot, we're going to looking for feedback on how you...
It's not always just cancer problems, things that affect your work or your family life or your relationships with your friends.
We're finding that it's making consultations really very focused and effective because we can very quickly drill down onto the areas that are of greatest concern to our patients.
The clinician who's carried out the assessment with the patient will come up with a care plan, which is basically a list of actions to see if we can address some of the issues that have come up in the assessment.
You're welcome. Good to see you. The second part of the recovery package is a treatment summary record, which is really about making sure there's good communication between the hospital, the GP and the patient, and that everybody is aware of what has happened through the course of treatment.
For other healthcare professionals that may not be in direct contact with that patient, it gives them the opportunity to have an understanding and an awareness from a medical perspective as to what that patient's been through.
What it does do is encourages the consultant to say, well, the treatment's finished, I would advise that you do this and this. There are risks that disease might come back, and this is what you should do about it. And these are the signs you should look for. And also, these are the contact numbers you may need. So they get my contact number for a start. So it's a really good thing to do.
It's very easy for people to feel quite dropped at the end of their treatment. Sometimes that's the time when they come back to us as their GP to talk about things. And if we've got a treatment summary, then it means that we can have a much more useful review with the patient at that time.
The third part of the recovery package is what's called a cancer care review, which is a conversation between the GP and the patient, really to make sure that any ongoing needs or needs which hadn't really been understood at the moment of the end of treatment are picked up later, and then something can be done about it.
How are you doing?
Fine, thank you.
Not too tired? Having a structured template for the cancer care review prompts us to think about questions that GPs don't always think about. When we first see our patients, we tend to be very medical, but in fact for people affected by cancer, they often have very different needs and priorities that they want to talk about. Having a template that prompts us to ask about simple things about their understanding of their condition and their treatment to date, finance and benefits, checking whether they've been involved with other health professionals and referred to an OT or a physio or other people who may be helpful to them is really beneficial.
The fourth component of the recovery package is a health and wellbeing clinic, which is really a group event at the end of treatment where people have access to a clinical nurse specialist, perhaps a doctor, a benefits advisor, whatever it is that they individually and collectively need when treatment ends.
We have a marketplace of various cancer charities, providers and health information services to provide, in a very informal atmosphere, information for patients about the services they provide, about living well and living healthily, but done in an environment that is non-clinical, unthreatening, informal, and for patients to be surrounded by peer groups.
The Living Well and health and wellbeing clinics that we run give patients the opportunity to highlight problems with a clinical nurse specialist at that time, and we can also again then signpost them out from that day to other services if needs be, i.e. the dietitian clinic, the exercise clinics.
I went along to the Living with Cancer group sessions and they were amazingly helpful. Different speaker every week. Could be the practical aspects of living with cancer, perhaps some physiotherapy to help people relax, chance to meet other people in the same boat, different forms of cancer, but all wanting to get on with life. So it was immensely helpful.
Our role as Macmillan, now that the package has been developed, is to support its rollout across the United Kingdom. This, from our point of view, is incredibly important in making sure that cancer services are truly person-centred, patient-centred.